Hi, this is Dr. Fodero. I'm a board certified plastic surgeon and we're going to be talking about rhinoplasty today. So my first case is a very pleasant 23-year-old woman who comes to my office complaining about her profile. She doesn't like the way her nose looks like from the side, and she tells me specifically that she feels her nose is hooked. She also tells me that she has trouble breathing through her nose. She has no history of allergies, she has no history of sinus infections, but she has a chronically stuffy nose. So when I look inside her nose, she has a deviated septum. She has signs of what is called internal valve collapse, where the nose pinches in on inspiration, and she also has very big turbinates. So the plan for her is to make her nose more elegant, more pretty, and also to restore her breathing. So the first question she asks me is, what can my nose look like after the surgery? So what we do is we take her initial picture, and if you look really carefully here, you can see the bump that she has in her nose, and we take the computer and we actually simulate what her nose could look like. So here is a simulation. So the goal of the surgery, as we talked about, is to create a nice straight bridge and to have the relationship between the bridge and the tip be better balanced. So this is the goal of the surgery. This is what we're trying to achieve. And when I look at her post-operative pictures, okay, you can see that I think we've done a little bit better. So the bridge is now straight. Okay, there's a slight depression in this area. This is called the tip of the nose. We call this the super tip break. And so she has a very, very nice relationship now between the bridge and the tip. So her nose has what I consider elegance to it. We started with a nose like this that has a hooked appearance. We talked about what the nose could look like, and we used the morphing software. So this was the goal of the surgery. And then after surgery, I think we've achieved an even better result, an even more natural, pretty, soft version. So in this case, I think we did even better than the computer simulation, which is nice. Okay, so additionally, the patient did not like her nose from the front. She felt that the tip of her nose was too depressed, meaning that when she smiled, it was too droopy, and she didn't like the amorphous shape of the nose. She wanted something that was more defined. So we took her picture from the front, and we put it on the computer, and once again we morph the images, and the morphing shows that the nose now has been elevated and the tip has been somewhat refined. Okay, so this was the goal of the surgery. And when I look at pictures after her surgery, I think we've done even better, because now she has the tip of the nose has been lifted. The relationship between the bridge and the tip is in better balance. And when the light hits her tip, you can see these are called tip defining points. It's a natural, pretty, soft nose. And it doesn't look like she had surgery, which is really the goal. And I think once again, we've done better than the morphed images with this surgery. So when I look at her again from the side, so this is an oblique view. And so most of the time we're walking around, people see us from off angles. So this is probably the most important picture to look at when you're looking at rhinoplasty results. So in this case, you can see that the bridge is very prominent and the tip is dependent, meaning for a petite woman, the tip should be elevated in a more aesthetic position. So other questions that come up are, how much time do I need off for the surgery? I tell my patients that you need to give me a week. If you give me a week, I can give you a new nose. And so what typically happens is, say the surgery was done on a Tuesday. So you're going to be a little bit sore. The pain is reasonable. It can be managed with a few Percocet and mostly Motrin. You're going to have some swelling in the nose. Your nose is going to be stuffy. You may or may not be able to breathe through your nose for a few days. I usually recommend that you ice for 2 to 4 days. And after about 5 days, people are feeling pretty comfortable, but they're socially unacceptable. You can't go to work. You can't go to school. You're going to be basically home. On day 6, I typically will take the cast off the nose. I will take splints out from inside the nose if splints were used, and the stitches are usually just allowed to dissolve. So after 6 days, you can really return to normal activity. You may have a little bit of swelling, you may have some bruising, you may have a bloodshot eye, but it's not terrible, and most people feel comfortable going back to work or school. If you're concerned about that, then I would say take 10 days off, but you would never need more than 2 weeks off for a rhinoplasty in my practice. So I tell people that have had braces, how long does it take to get a result with braces? Probably 2 years. So I can give you orthodontic level change in your face in 1 week. So I think it's a pretty good deal. When I perform a rhinoplasty, I take some notes, and this helps me to look at my results and see what I could have done differently or better. So in this case, the rhinoplasty that I performed for this young woman. This is my schematic. So the first thing that I do when I do her nose is I make a small incision between her nostrils. It's called an open rhinoplasty. And most of the rhinoplasties I do are performed in this way. This is a more contemporary technique. It gives me more control of the final result. So the first thing I do is I make an incision between the nostrils and I expose the tip and the bridge of the nose. Then I enter the septum from the top. And so this is a representation of the septum, and the septum is made up of bone and cartilage. And in order to straighten it, what you need to do typically is to remove a little bit of tissue, a little bit of cartilage from the bottom, and then to remove a little bit of the central portion of the septum that's deviated. This also gives me some cartilage to use to make the nose prettier. And that maneuver straightens the nose, or straightens the inside of the nose to improve her breathing. So then the next thing that I do after I've addressed the septum and I've taken a little bit of cartilage for other purposes is I take down the bump. So the bump in her is made up of a little bit of bone and a little bit of cartilage. So I take my rasp and I file down the bone and I trim this extra cartilage. And then the next thing that I do is I do a little bit of work on the tip. So I remove a little bit of this cartilage and I put some sutures in to refine it. And so the key is to have the bridge and the tip to balanced. So the best way to achieve that balance is to do a little bit of work in the bridge, a little bit of work on the tip, and then go back and forth until they blend together. The other thing that I did for her is I added a little cartilage called a columellar strut, and what this does is it helps to keep the nose in a new elevated position so it doesn't droop when she smiles. And then I added a little tip graft to add a little bit of elegance and a little bit of refinement to the tip of her nose, because her initial complaint was that the nose was too amorphous or didn't have enough shape. Typically, when you take down a bump, you're left with what's called an open roof. So you have nasal bone, flat space, and nasal bone. So that open roof has to be closed. So I make cuts in the bone on the right side of the nasal bone and the left side of the nasal bone, and very gently I move the nasal bones back into the midline. And by doing that, what I do is I create a more natural bridge of appropriate width. Now for her, she had some functional issues, so we straightened her septum, which improved her breathing. We actually opened up her airway by creating a little space between the sidewall of her nose and the septum with spreader grafts. And then lastly, she had some turbinate hypertrophy, which I reduced in the OR. So at the end of her surgery, she ended up with a nose that was more elegant, with a smoother bridge, an elevated refined tip, and a tip and a bridge that blend together. She had an improved airway with a straight septum, an opened internal valve, and reduced turbinates. So she's very happy. She's a few years out now, and she has a good cosmetic and functional result. So I'm Dr. Fodero, and my practice is Northeastern Plastic Surgery, and we're here in Florham Park, New Jersey, and we'd love to see you in consultation.